Yes, ma'am.
My husband was diagnosed with Alzheimer's about 5 years ago at stage 5. However, he has, people say that he doesn't have Alzheimer's because they talk to him and he seems perfectly normal.
Mhm.
However, my question is that he has a lot of congestion in his chest. He now is in the hospital with congestive heart failure. I want to know, do you think that it's the congestive heart failure, or he's had this congestion for a long time? So when that produces phlegm, is that what causes that? And he's had this for 14 years.
The likelihood that you would have Alzheimer's disease for 14 years is unlikely. Okay? Think of it like driving on a flat tire. How far do you think you can drive on a flat tire? Maybe a mile? What about 100 miles? Probably not. It's possible, but probably not. So the likelihood that he would have Alzheimer's for that long is unlikely. My question to you would be, how bad was his congestive heart failure at the time that this all began?
How long was what?
How bad was his congestive heart failure when this all began?
He's had congestive heart failure for 6 months. However, when he was diagnosed about 5 years ago, I mean, he still doesn't know what day it is. He doesn't know where the dishes are. He doesn't know where a lot of things are. When he talks to people, I don't even intervene and tell them he's not telling them the truth and so forth. So, and that is going to a decline. So, but he was diagnosed with this by Dr. Bernard Jasmine 14 years ago, because he was throwing the dishes away, he was throwing things, and the primary doctor said there was nothing wrong. But I said something was wrong because he's doing all these crazy things.
Mm-hmm. Alzheimer's is not the only form of dementia that's out there. There are many other sources. And if you heard earlier that I said that with all the work that I described earlier in the lecture, we get about 95% accurate. Well, that means that 1 in 20 patients we're wrong on. Okay? What are other possibilities with your husband? Could it be multi-infarct dementia? Could it be a vitamin deficiency dementia? Could it be a Lewy body dementia? I don't know. But it would be interesting to look at the MRI scan of his brain. The unfortunate thing is that given that he has had it for so long that no matter what the source is, it's unlikely that it's reversible. Combine that with the fact that it sounds like he has fairly bad congestive heart failure to the point that his lungs are congested. That's a person with fairly bad congestive heart failure. That means his ejection fraction, the amount of blood that his heart can pump out every time it squeezes, is fairly low. So these are usually bad indicators.
Does congestive heart failure increase the dementia?
It can. Any underlying medical disease can make the dementia look worse. We see this all the time in patients who come into the hospital, so perhaps they have a mild dementia. So they're just a little forgetful, but they can still do most things for themselves. But they come in with a urinary tract infection, and all of a sudden the whole world has just collapsed around them. They can't even figure out who the lady bringing them into the hospital is, despite the fact that it's their wife of 50 years. So medical conditions can affect the situation, absolutely.
Thank you.
I have a question.
Yes, ma'am.
What is the difference between vascular and Lewy body dementia, and is the treatment different?
Yeah, vascular dementia is, think of Alzheimer's disease to start with. We'll use that as our paradigm. So with Alzheimer's disease, you have these toxic little proteins all over the brain, and they're destroying microscopic areas of the brain. Well, vascular dementia is kind of the same thing, but it's due to blocking of the blood vessels inside of your brain. And instead of knocking out little microscopic areas, now you're knocking out large areas that are big enough to be seen by MRI. All right? So vascular dementia progresses at a different rate than Alzheimer's dementia or Lewy body dementia, and it is a different pattern. So these patients may present not only with memory loss, but with visual loss, imbalance very early on in the disease, unilateral weakness or numbness, speech deficits, swallow deficits. Virtually any part of the brain can be affected by multi-infarct dementia. It's basically just picking off random bits and pieces of the brain, and at that time you're losing memory. The memory in those folks is typically not the sole feature that brings him to the doctor's office. It's usually other things that will also, so yes, he has memory loss, but he also has imbalance. He has this, he has that, he has the other. So the patient's family will help delineate that. Lewy body dementia is another form of dementia. It is a distinct toxic protein inside of the brain that helps destroy the memory centers. Unfortunately, Lewy body dementia has a slightly faster course of disease compared to Alzheimer's disease, and it can usually be distinguished from Alzheimer's disease because the patients come in not only with a little bit of memory loss, but they come in with a lot of hallucinations. One of the first patients I ever saw with Lewy body dementia came in to me, and the wife said, well, he's having hallucinations. In Alzheimer's disease, you can get hallucinations, but it's typically more in the advanced patients. And the hallucinations that these people are describing to you are vague. There's a vague person in the corner of the room. There's a cat in the corner of the room. I don't really see what it is. They can't really describe what they're seeing. But the Lewy body dementia patient, they give you this vivid description. This first patient that I had, he had a team of gypsies that worked for the circus, and they would come into his backyard every day, and they would give him a whole circus performance with bears and lions, and it was very detailed. It was amazing. But that tells you, this is probably not Alzheimer's. This is more detailed than an Alzheimer's dementia patient.
Would Lewy body take away the ability to walk?
All dementias can take away the ability to walk in the advanced stages. Eventually, they're going to start knocking out more basic function. They'll knock out not only who you are and who the children are, but they'll also knock out their language ability. So you'll notice as the Alzheimer's patient, for example, as they progress, their language isn't as rich as it once was. The other thing is when they go to describe something, they'll sit there and they'll look for the word. All right? And it gets worse as time goes on. So, yes, Lewy body dementia can do that too, unfortunately.
I have a question for you, doctor, and I'm 81 years old, and I know this last 6 months, I forgot my hearing aids, or I've lost my keys.
Yes.
Things are happening. Is that a sign of having dementia? Or
No pressure,
It's not uncommon to forget your keys, and it's not uncommon to forget where you parked your car, as long as that's the way you've been. Now, if you've always been a very organized person, look, I walk into the house, the wallet goes in the box, the keys go here, this goes here, but all of a sudden there's a change in your pattern where, where did I put those keys? I can't remember that. That's worrisome. It's more worrisome than the person who's always been a little disorganized in their life. You know, the prototypical artist. You know, they're kind of a little, disorganized sometimes because they're artsy. You know, as opposed to the accountant or the engineer. This is how things are. Also, I would worry more if there's been a change in your personality. If the family members begin to notice that there's a change in your personality, that definitely should be looked at.
thank you.
Welcome.
Have there been any studies on the relationship between autism and dementia?
In what way? In autism in the children and the parents ending up with dementia?
No, characteristics of, for example, no affect. Characteristics of autism that seem to be present in dementia.
To my knowledge, I don't know that they've prospectively followed individuals with autism into late life, specifically looking at dementia. I don't know if these people are at higher or lower risk for dementia. My suspicion is that the autistic brain is not wired correctly. Okay, and because of that, it's probably more prone to things like Alzheimer's disease. It's like having a car with a bad engine right off the lot. Well, is that car going to run 200,000 miles like a normal car? Probably not. It's because it's starting at a disadvantage. And I think that perhaps, now that's supposition on my part, that's not based in data. But if I had to make a guess, I would say probably yes. Yes, sir.
Is Alzheimer's hereditary? If the mother had it, what's the chances of the daughter getting it?
The question is Alzheimer's hereditary? And that is becoming a very interesting topic. 15 years ago, I would have told you absolutely not. No way, no chance. And then about 14 years ago, we discovered the ApoE4 genetic marker. If you are ApoE4 positive in both of your chromosomes, you are at a dramatically higher risk of having Alzheimer's. Shortly after that, we discovered the presenilin 1 and 2 genes. And guess what? You are at dramatically higher risk if you have those. How do you know if you have that? Look at your family history. If your grandmother had it and her son, who is your father, had Alzheimer's, there's a gene that's trying to track its way through that family, and you are probably at a significantly higher risk. It depends on lifestyle as well. I've seen patients with family members who died in their early 50s with Alzheimer's disease, but they lived into their 80s. And if you start looking at the way they lived their lives, were they obese? Were they diabetic? Were they smokers? How did they eat? Did they exercise? These things all have a significant impact on when you come down with the disease. Because let's face it, coming down with Alzheimer's at 85 is different than coming down with Alzheimer's at 55. So if you are at a slightly higher risk category, it's time to get serious about your health, diet, and exercise, and quitting your smoking, and even taking care of your diabetes.